Hi, Sherry. My name is McKenna. I'm going to be your student nurse practitioner today.
Nice to meet you, McKenna.
Nice to meet you too, Sherry. So what brings you into the office today?
I'm having severe joint pain, and especially my lower right side of my back.
Okay, when did this all start?
It's been getting worse progressively for the last 10 years.
Okay, does it radiate anywhere else?
No.
Can you describe the pain for me?
It's burning, dull, burning ache, and it limits my motility.
Okay, on a scale of 1 to 10, with 10 being the worst, can you tell me how bad the pain is?
It can get to 10. It's not 10 all the time, but if I aggravate it, it can get to 10.
Okay, so it sounds like it's constant pain then.
Yep.
Okay. When it's out of 10, how long does it usually take for that pain to go away?
I can't. A couple days.
Okay. Is it worse at a certain time of the day?
I'm very stiff in the morning when I wake up.
Okay. Anything else that makes it worse besides movement?
Well, when I'm gardening or cleaning or any physical activity, I'm trying to be so careful about bending my knees, but it really aggravates my lower
It
back.
sounds very debilitating.
It is.
Any other associated symptoms?
No.
Anything that seems to make it better?
Ibuprofen.
Okay. How often do you take the ibuprofen?
Once or twice a day.
Okay. And the dosage of that, Sherry?
I think it's 800 milligrams.
Okay. Any other medications?
Nope.
Okay. Any past medications?
No.
Very good. Any allergies to medications?
No.
Any vitamins, herbal remedies, or supplements?
Not the moment.
And I see you have some scars here, your knee. Can you tell me a little bit about that, where it was done and how old you were?
My knee, I was 12. I wrecked a motorcycle. Holy Spirit Hospital put it back together. 10, 11, my arm went through a window. Holy Spirit Hospital put it back together. It was just all ripped up. This was due to my I have a disease. I can't remember what it's called, but 3 vertebrae fused, 2 discs replaced.
Okay.
It's a disc disease.
Degenerative?
Yeah, degenerative disc.
Very good.
This was last November by Dr. Joel Weiner in York.
Okay, very good, Sherry. Do you follow up regularly with a physician?
Once a year.
Okay, how would you describe your general state of health?
Good, except for my joints.
Okay, other than the degenerative disc disease, do you have any other past or chronic illnesses?
No.
Any other active or chronic diseases that you want to talk about today?
No.
Very good. Any allergies to anything, Sherry?
No drug allergies. I know pollen.
Okay. Any allergies to like any foods or anything?
Mm-mm.
Very good. Do you smoke?
No.
Any drugs or alcohol?
I do not drink alcohol.
Very good. I know that you said, it's hard to move around. Are you exercising at all?
I'm not.
Okay. What about sleeping? How's your sleep with the pain?
It interrupts my sleep. Sometimes I get a good night's sleep, but other times I'm tossing and turning.
Okay. How many hours would you say you typically get?
8.
Very good. That's good. I'm glad to hear that. Can you tell me what you eat on a typical day?
I eat very well. I'm half vegetarian. I eat a lot of good fresh vegetables, salads.
Okay, very good. Have you had all your childhood vaccines?
Yes.
Okay. What about flu or pneumonia?
No.
Okay. What about meningitis?
No.
Okay. Shingles?
I'd like a shingles.
Okay. We can definitely take care of that for you. If not today, then another time. Okay. Very good. Do you have any hobbies, Sherry?
Tons of hobbies.
Okay.
Gardening, make jewelry, cook.
Okay. Are you still able to do that with the pain?
Get by.
Okay. Have you traveled outside the country recently?
No.
Very good. Can you tell me what you do for a living and what kind of setting you're working in?
I'm a loan officer for a mortgage company, and I'm on the computer, so screen and sitting still for long periods of time.
Okay. Does that seem to make the pain worse?
Yes, it makes me really stiff.
Are you married, Sherry?
Nope.
Do you feel like you have a good social support system?
I have a great church family, yes.
Okay. A little bit more personal. Are you sexually active?
I am not.
Okay. Do you remember the last time you?
Years.
Okay. Do you know when your last menstrual period was?
3 or 4 years ago.
Okay. So you're currently in menopause then?
Yep.
I want to talk a little bit about your family history. If you could tell me about your parents, their ages, any illnesses they have.
My mother has terrible arthritis, and I believe it's also rheumatoid and osteo. She's 75. She's had many surgeries due to it. My dad is 79, and all he has is high cholesterol he has to deal with.
Okay. Do you remember anything about your grandparents?
No.
That's okay. Do you have any siblings, Sherry?
Older brother and a younger brother. My older brother's 60. He has bad arthritis.
Okay.
My younger brother's 52, and he has bad arthritis.
It sounds like that runs in the family then.
Yipper.
Do you have any children?
I have 2 rock star girls, 33, 29. They're in excellent health.
Wonderful. I'm really glad to hear that. Any fever, weight loss, weight gain?
Just a little weight gain.
Okay. Any weakness or fatigue?
I think so, McKenna. I think I'm weaker.
Okay, all over your body?
Yes.
Okay. Any issues with your skin?
Yeah, it's dry due to that menopause.
Okay, any rashes or lumps?
No.
Very good. Do you have any issues with your bladder?
No.
Okay, no incontinence, urinary tract infections, or kidney stones? Very good. Any changes in your mood, memory, or attention?
Getting older. I get a little forgetful.
Okay. Do you have any numbness or tingling?
Not anymore.
Very good. Any intolerance to heat or cold?
No.
Any excessive thirst, hunger, or sweating?
No.
Very good. Any anemia? Do you bruise or bleed easily?
No.
Very good. What about any swollen glands?
No.
Very good. Have you ever had hives or an allergic reaction before?
Not that good.
Very good. It sounds like you're in pretty good health here.
Yeah.
Any chest pain, palpitations, or hypertension?
No.
Any shortness of breath, wheeze, or cough?
No.
Very good. What about any nausea, vomiting, diarrhea, constipation? Very good. I'd like to move on to the physical portion of this exam. I see that my MA already got your vitals, height, and weight, so I'm going to go ahead and start by taking a look at your scalp and palpating, okay?
All right.
Excellent, Sherry. Good. Could you go ahead and just bend your head back for me so we can take a look at the top here? Excellent. Okay, I'm going to go ahead and palpate. Very good. Everything seems normal. Next thing I want to do is I'm going to palpate your temporal mandibular joint, which is just kind of part of your jaw. So if you could go ahead and open your mouth for me. Very good. Go ahead and close. Move your jaw side to side and front to back. Very good. Go ahead and raise your eyebrows for me. Go ahead and close your eyes as tight as you can. Don't let me open them. Okay. Give me a smile. Frown. Show me all your teeth. Puff out your cheeks. Very good. I'm going to go ahead and feel your lymph nodes now. Okay. So let me know if you have any tenderness while I'm doing this.
Anything happening?
Nope, everything feels great, Sherry. Okay, next what I want to do is I'm going to check out your thyroid gland here. Okay, so I'm going to go ahead and give you this water.
Nobody's ever done that before.
We're doing a whole head to toe here. Make sure we don't miss anything, okay?
Mm-hmm.
Go ahead and swallow. All right, so I'm going to find your cricoid. Underneath should be your thyroid. I want you to take a sip of water and then just slightly extend your neck. And swallow. Excellent. Next, I'm just going to kind of move your trachea here to check out either side. Everything feels great, Sherry.
Sweet.
Next, I want to check out some range of motion with your neck. If you could go ahead, I want you to move your neck forward for me and backwards. Very good. Side to side. Very good. And then there you go. Looks like you do that often, huh?
Yeah, well, the 3 plates, I try to get some range of motion.
Okay, it looks a little bit limited, though.
It sure does.
Any pain?
Yes.
Okay. Next, what I'm going to do is I'm going to go ahead and move on to your heart. So I'm going to go ahead and just palpate your carotid. Very good. Good. I'm going to go ahead, if it's okay, to lift up your shirt here. Check out your apical impulse. You're very thin here, so I should be able to feel it while you're sitting. Excellent. Okay, if you could just keep that up for me, I'm going to go ahead and listen to your heart now as well, as long as you're comfortable.
I am, yes.
Very good, Sherry. I'm going to have you go ahead and sit in this chair over here. I want to take a look at your eyes now, okay?
Mm-hmm.
Very good. Okay, so the first thing I'm going to do is I'm just going to check your red reflex. It's that redness that you get in eyeballs and pictures.
Okay.
Very good. I'm going to go ahead and check your pupillary response. Okay. Just going to go ahead and pull down your lids here. Take a look up for me. Very good, Sherry. Excellent. Everything looks normal there.
Good.
I'm going to go ahead and take a look in your eyes with my ophthalmoscope. I'm going to have you turn a little bit here. Excellent. So I'm going to go ahead and start with your right eye. Okay. And take a look at the light for me. Very good. Again, stare at a point past me on the wall. You were already doing that, so I'm guessing you've had your eyes checked before.
Yeah.
I'm trying to look at the light for me. Excellent, Sherry. Okay, any issues with your eyes?
They're just dry, McKenna.
Any redness or pain?
Yeah, they're red.
Okay. Any loss of vision, blurred vision, double vision?
No.
Very good. Next what I want to do is check your peripheral vision. So I'm going to go ahead and put my glasses back on. I want you to go ahead and close one of your eyes. I'm going to close the opposite eye. Let me know when you can see my fingers, okay?
Yep. Yes. Yes.
Very good. Other eye for me. Very good.
Yes. Yes.
Okay, you can keep that eye closed. Very good. I'm going to keep my opposite eye closed. Let me know when you can see the red pin.
Yes. 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 Yes.
Very good. Other eye for me, Sherry.
Yes. 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 Yes.
Excellent. Okay. Next thing I want you to do here is, sorry, I want you to follow my finger. Okay, I'm going to check your eye movements. Keep your head still for me. Excellent. Okay. Next, what I'm going to do is check your hearing here. Okay.
All right. Yes, there's a little loss of hearing.
So I was going to ask you that. Any ringing in your ears?
No.
Okay. Any discharge or pain?
No.
Very good. Good. I'm going to take a look in your ear here. Same thing on the other side.
How's it looking there, Doc?
Looks good. I don't see any issues. Everything looks as it should. Very good, Sherry. Okay. Next, I'm going to test your hearing. Okay, see if you do actually have some loss here. So it's called the whisper test. I'm going to close one of your ears here, and I'm going to whisper a combination of letters or words. About 2 feet behind you. I want you to tell me what I'm saying. Okay.
I couldn't make it out.
That's okay.
Can't make it out.
Okay. Well, we're going to move on then to further test your hearing. I'm
I
going
can
to
hear the whisper. I just can't tell you what he said.
That's okay. It sounds like you might have a little hearing loss. I might end up sending you to an ENT or referring you to one, okay, just to get a better idea of what's going on.
Sure.
All right, so what I'm going to do is I'm going to hit my tuning fork. I want you to tell me which ear you hear it out of the best, or it could be both as well.
Lefty.
Okay. I'm going to go ahead and put it behind your ear. Let me know when you can no longer hear it.
Stopped.
Okay, let me know when it stops.
Stopped.
Very good. Same thing, Sherry. Let me know when it stops.
Stopped.
And again.
Stopped.
Very good. Next thing what I'm going to do here is I'm going to go ahead and check your, palpate your sinuses, okay? You're okay. Any pain or tenderness?
Mm-mm.
Very good. Okay, I'm going to go ahead and look up your nose now, okay?
Fun.
Yes, I'm sorry. It's not the best part of the exam, but I just want to make sure you don't have any swelling or anything like that. Good, same thing here. Everything looks great, Sherry. We're going to go ahead now and move on to your mouth. I'm going to go ahead and put my gloves on, okay?
Yipper.
Maybe.
I like your office.
Thank you.
A lot of original artwork.
Thank you. So first thing I'm going to do is I'm going to pull your lips down. Good, let me get out my pen light, actually. Good. Okay, I'm going to go ahead and move your cheeks side to side. Good. Can you lift your tongue up for me? Good. Can you move it to the left? And then to the right. Very good, Sherry. I'm going to go ahead and use my tongue to press through here. Okay, which I have seemed to... Oh, found it. Okay. I lost it. All right. Can you open up your mouth for me? Very good. Oh, sorry. Go ahead and say ah.
Ah.
Good. Can you stick out your tongue for me as far as you can? Very good. Can you move side to side? Excellent, Sherry. Can you go ahead and touch your cheek really hard with your tongue? Same thing on the other side. Very good. All right, Sherry. So next I'm going to go ahead. We're going to move on to your lungs, okay? I did forget to ask you, do you have any issues with like a sore throat,
No.
ulcers, anything like that?
Nothing like
Very
that.
good. And no issues with your nose, right? No nosebleeds, runny nose?
No.
Very good. No congestion?
No good cold.
Okay, very good. All right, Sherry. So what I'm going to have you do here is kind of face a little bit this way. Very good. So the first thing I'm going to do is palpate the front of your chest here. Let me know if you have any pain. Also looking for some crepitus. Is it okay if I lift this up again? Okay, very good. Thank you. Good. I'm going to go ahead and palpate your shoulder as well, starting at your sternoclavicular, going up your clavicles. Okay, very good. To the acromion. All right, and the greater trochanter there and down into the bicipital groove. Very good, Sherry. Okay, next thing I want you to do is say 99.
99, 99, 99.
Very good. I'm going to go ahead and take a listen now. Okay, so nice deep breaths for me. And one more for me. Excellent, Sharon. I'm going to have you turn around for me now. If it's okay, I'm just going to keep this back part up.
Sure.
Okay, I'm going to go ahead and do the same thing back here. I'm also going to palpate your scapula while I'm back here, okay? Which is part of your shoulder. I'm also going to palpate your spine, which feels good, nice and straight. Feel any issues there? Any pain when I'm pushing down here on your lower back at all?
There's only one spot down there.
Okay, is that the right side then?
Yep.
Okay. I'm going to go ahead and palpate your sacroiliac joint, which is part of your hip. Very good, Sherry. Next thing I want you to do, we're going to do the 99 again here. I want you to say 99.
99, 99, 99, 99.
Very good. I'm going to go ahead and percuss your chest. I'm going to have you move this way for me, listening for a nice resonant sound, okay? Which is what your lungs should sound like. Just going to pull this down a little bit. That's okay. Very good. I'm going to go ahead and take a listen now, okay? Actually, we already did the 99, so yes, I am going to take a listen. Couldn't remember. Okay, nice deep breaths for me. Very good. I want you to go ahead and say 99 for me.
99, 99, 99, 99.
And E.
E, 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 E.
Very good. Next, I'm going to go ahead and test for pyelonephritis here, which is just your kidneys. I'm going to go ahead and kind of hit your back. It might be uncomfortable, but it shouldn't cause you any pain, okay? So let me know if it hurts. Ready?
Okay.
Good.
Okay.
Excellent, Sherry. Next one I'm going to have you do is I'm going to have you stand up for me. Okay. I want you to go ahead and close your eyes for me for about 30 seconds, okay? Just checking your balance here. Very good, Sherry. Next thing I want to do is I'm going to have you come towards me. I want you to turn around. I want you to go ahead and bend over for me if you can. Let me know if this causes any pain too, because I know you're a little stiff.
Yeah.
Okay. Very good. You can come up, Sherry.
It's one of those things that feels good to do.
Come on back for me. Good. I am going to send you home with some range of motion exercises to kind of do daily, okay?
Yep.
I want you to go ahead and rotate side to side. Very good. I want you to go ahead and bend at the hip sideways. Excellent, Sherry. All right. Next thing I want you to do, I want you to face me. We're going to do some shoulder range of motion and strength, okay? So first thing I want you to do is raise them up in the air and way behind you. Very good. Bring them out to your side. I want you to drop slowly. This also tests your strength. It's the drop arm test. Very good. I want you to bring them across. And again. Good. I want you to kind of turn around like this and touch your scapula with either side. Very good. Just want to take a look. Excellent, Sherry. Okay, next thing I want you to do is show me your biceps and put them down. Good. Okay, go ahead and relax for me.
Relax.
Yep.
Right.
That's okay. I'm going to go ahead and move your arms out to the side. I want you to keep them there for me, okay? A little stiffness I can feel. Very good. And just keep them there. Very good. Come towards me. I want you to turn around. We're going to test the back as well. So I'm just going to take your arm here. I want you to go ahead when I, there we go. I'm going to move your hand back. I want you to keep it there, okay? Very good, Sherry. Same thing on the other side here. And go ahead and keep it. Okay. A little bit of bounce in there, so a little loss of strength I can see. Next thing I want to do here is I'm going to go ahead and test your gait, okay? Walk normally. Very good. I want you to walk back heel to toe like a sobriety test. A little wobbly there.
Yes, I am.
Okay. I want you to walk back now on your toes. Very good. And on your heels for me. Excellent, Sharon. Next, I'm going to have you come sit up on this table. Very good. So I'm going to palpate your elbow and your wrist and your knee, okay?
Feeling any nodules?
Not yet. I do a little bit in your hand here, okay? It's usually indicative of osteoarthritis, which it sounds like that runs in your family. So I'm thinking that might be part of the cause of what's going on today with your back pain. It is a disease that gets progressively worse over time. Also with the degenerative disc disease, I'm thinking that might also be
Wonder if there's supplements I should take.
We're going to test some blood work when we're done here. I'm going to go ahead and get a CBC and a CMP, which is just going to test your electrolytes, okay, as well as a blood count. I'm going to get a vitamin D as well as a calcium level, okay?
Okay.
Might have to put you on some supplements, so that's how we'll find out, okay?
All right.
When we're done here too today, I'm going to go ahead and set you up with a physical therapist. I want to get some of your muscle tone back because you have a little decreased muscle tone I can see here. I do feel some nodules in here as well, and I see that you have some limited range of motion. I kind of want to get you back to a normal baseline function.
That would be
so maybe you can start doing some of the things that you love.
Thank you.
Absolutely. And then what we'll do is I'm going to go ahead and schedule a follow-up appointment with me in about 6 months.
All right.
We'll do some repeat blood work just to make sure everything's okay there
I think
too.
I've landed with the right doc.
Thank you.
Help me go into old age.
All right, I see this knee has a little bit more swelling. It also has some nodules in it, just like your hands.
I know, it's so ugly.
Very good, Sherry. Okay.
I can't wear mini skirts anymore.
Sorry to hear that. Can you go ahead and move your legs up for me in the air? I want you to bring them back. Good, and go ahead and relax your legs. I'm going to show you what I want you to do. I want you to go in and out. So do that with each leg for me. Very good. Same thing with the other one. In and out. Very good, Sherry. Okay, next thing I want you to do is I want you to flex your muscles. Okay, push back. Push in. Nope, this way. There you go. Very good. I want you to stick your hands out. I want you to bring your palms up, palms down. Very good. I want you to pretend like you're dumping out a can. This is the empty can test. It lets me know if you have a rotator cuff tear. Okay. So I'm going to go ahead and push down, resist. Excellent, Sherry. Next thing I want you to do is I want you to put your hands up for me and wave at me back to forth. Wave with just your fingers. Give me a claw. Give me a fist with your thumbs on the outside. Stick your hands out for me. Don't let me push down. Very good, Sherry. I want you to go ahead and spread your fingers. Good. Don't let me push them in. A little decreased strength here in your fingers.
Yeah, that's definitely an area of weakness.
Bring your thumb across your hand. Go ahead and bring it back. I want you to try to touch your thumb to your pinky. Same thing here, thumb to pinky. Very good. I want you to go ahead and go like this for me. This is the Tenniel test. So it's going to let me know if you have carpal tunnel. Let me know if you have any numbness or tingling, okay?
No.
Very good. I want you to go ahead and do a reverse prayer. Hold this for about 30 seconds. Same thing. This is the flange chest. It's going to let me know if you have carpal tunnel. Any pain, just let me know, okay?
No.
Okay. Very good. What I want you to do now is I want you to, we're going to do your reflexes. Thank you. Okay, right. This is your tricep, bicep. Good, and your brachioradialis. Good. Same thing on the other side, Sherry. Very good. Good. Very good. I did forget one thing. I want you to grip my fingers really tight. Excellent. Okay, I'm going to go ahead and test your knee patellar reflex as well. Let's try that again. Good. Good. All right, Sherry, I'm going to go ahead and lift up your leg. I'm going to go ahead and test just the one for now, your Achilles reflex, okay? Very good. Same thing on the other side. Very good, Sherry. All right, I'm going to have you go ahead and lay down for me. We're going to go ahead and do an abdominal assessment. I'm going to test your sensory function. Okay, actually, can you sit up for me again? I forgot one thing. Sorry, I'm going to move around.
That's okay.
All right, can you bring your heel to your shin for me on the opposite side? Up your leg. There you go. Same thing, bring your foot up. Very good. I want you to touch my finger and then your nose. Very good. Same thing with the other hand, Sherry. Very good. Great coordination. Now you can go ahead and lay down.
Really?
Yes.
So my dad said that.
All right, Sherry, I want you to close your eyes. I'm going to poke you with a sharp object.
Oh, that sounds great.
Yes, it should be. It's like a little acupuncture. So I want you to tell me if it's sharp or dull when I poke you, okay? Very good.
Sharp, sharp, dull, dull, sharp, dull, sharp, dull, sharp, dull, sharp, sharp. Ouch.
Sharp, sorry.
Dull, sharp, dull, sharp, dull, sharp, sharp. Ouch!
Sorry. Sharp.
Dull, dull, dull.
Very good, Sherry. I'm going to do the same thing, but this time no pain. I'm going to poke you with a soft cotton ball. Okay, let me know when you can feel it.
Yes, 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 yes.
Very good. Next thing I want to do here is I'm going to do the Berdinsky sign just to see if you have a subarachnoid hemorrhage or meningitis. So just nice and still for me. Excellent, Sherry. All right. I'm going to go ahead and do your pulses as well. Your radial, your brachial. Same thing over here. Very good. Your popliteal. Good. And the pedal pulses here. Everything feels great with that. Very good, Sherry. Okay. Next thing I'm going to do is I'm going to go ahead and palpate your hip and then your ankles, okay? Your iliac crest here. Very good. And your ankles. And your feet. Toes. I don't feel any nodules down here, which is great. Very good. Okay, I want you to point your toes towards you, point them towards the wall, move them inwards, just at the ankles and outwards. Very good. I want you to push down, push up. Very good. I want you to bring your knees to your chest. Very good. Go ahead and relax. Okay, I want you to push out with your legs and in. Very good. I'm going to bend your leg here. This is called the obturator sign. It's going to let me know if you have any appendicitis. Let me know if you have pain in your stomach. It's also rotation with your hip, okay?
Yep.
Any pain? Good. Oh, good. Like I said, these are the exercises I'm going to kind of send you home with. Also, the physical therapist will do this stuff with you as well, okay? Okay, so go ahead and put your leg up for me. I want you to go ahead and try to straighten your leg. Bring it back. Same thing on this side, Sherry. Go ahead and try to straighten and bring it back. Very good. Go ahead and relax. I'm going to go ahead and do the Lockman test. It lets me know if you have an ACLS tear as well, okay? Very good. Alrighty. Next thing I'm going to have you do is roll on your side for me. Very good. And I'm just palpating your trochanter. Go ahead and go in the fetal position for me. And checking the bursa. Very good. Go ahead and straighten out. I want you to bring your leg up in the air. Very good. I want you to lay on your stomach for me now. Very good. All right. I want you to bring your leg up in the air. Good. Same thing with the other leg. Very good. I want you to turn on the other side. Good. And go ahead and kind of, again, same thing. Good. I want you to go ahead and straighten your leg up in the air. Very good. I want you to lay on your back for me. I want you to bring your leg, bend it up. Go ahead, straighten. Bring it over just like that, okay? So go ahead and do that for me. Good. Same thing on the other side. Very good. Sure. We're going to go ahead and move on to the abdominal assessment. So the first thing I'm going to do here is I'm going to go ahead and listen. Good. I'm going to listen at your aorta, your renal arteries, your iliacs, your femorals. Same thing with the other side. Good. Listening for liver friction ribs over the spleen. Very good. I'm going to go ahead and percuss. Same thing with your spleen. Good. Take a deep breath. Very good. Same thing over here. I'm going to test your liver span. Very good. And coming down. Good. Your liver span measures at 7.5 centimeters, which is perfect. Next, I'm going to do some light palpation. Good. And some deep palpation. Very good, Sherry. I'm going to go ahead and push up here. And I want you to go ahead and take a deep breath. Same thing on the other side. This is the Murphy sign. It lets me know if you have cholecystitis. I'm also going to palpate your liver. So go ahead. Oh, sorry. Go ahead and take a deep breath. Excellent, Sherry. That concludes our assessment today. We already went over your plan, so I'm going to get that set up for you today. It was nice meeting you.
Thank you very much.
Absolutely.
Good luck.
Thank you.